So, let's say you have a 7-year-old kid, okay? They just come strolling into your emergency department all willy-nilly on a Thursday afternoon. You take a step back, okay? You look at the kid, they have one of these sort of makeshift slings on. He's kind of holding his forearm as such. All of a sudden, mom comes up to you and she's just like, Doctor, you wouldn't believe what happened. We're outside in a backyard, and all of a sudden he just fell on the edge of the sandbox, and oh my goodness, it's so swollen. I was on the way here, and I was Googling a bunch of things about radiation, and oh my gosh, I just don't know what to do. Do you think it's broken, doctor? And you think to yourself, do I really need an x-ray to make this diagnosis? Or can I use ultrasound? So before I get any further, by quick show of hands, don't be shy, how many ultrasound fans do we have out here? A lot. Great. I love it. So where I did my residency training, we had an anesthesia ultrasound rotation where we would wake up early in the morning, go upstairs, intubate patients, and then come down and scan. Now, sure, many of you have had this similar rotation. Maybe some of y'all are going through it right now, but you want to know what our nickname for this particular rotation was? Any wild guesses? Tubin and Lubin. That's right. Tubin and Lubin. No, but I love ultrasound. Love it, love it, love it. I don't love it enough to do a fellowship, though. We're just going to put that in the air right now. But I love using it on shift. So that brings me to this super intriguing paper that was published in March of 2023 in the New England Journal of Medicine. Yes, they're fancy. Entitled Ultrasonography or Radiography for Pediatric Distal Forearm Fractures. So I'm going to quickly kind of go through the methods really briefly. So this was an open label, multi-center, non-inferiority trial based out of Australia. They enrolled 270 kids from the ages of 5 to 15 who presented to the emergency department with an isolated distal forearm injury, however, no clinically visible deformity. Now, they were then randomized to either go point of care ultrasound or x-ray, right? They were followed for a period of 8 weeks, and based on something called the PROMISE tool, they were assessed for their physical function. They also recorded secondary outcomes such as patient caregiver satisfaction, pain, frequency of complications, need for repeat radiography, and ED length of stay. Now, all of this was assessed by a team made up of 3, okay? We had a pediatric radiologist, pediatric orthopedic surgeon, and an emergency medicine doc who was PIM trained. And at the end, ultrasonography was found to be non-inferior to radiography. No clinically important fractures were missed, and in the ultrasound group, I might add, ED length of stay was shorter, kids missed fewer days of school, and parents were just happy to spare their kid a dose of radiation. Beautiful, right? So I just want to take a step back and just say, as the ultrasound fanatic that I am, I really enjoy papers like these because they bring up the conversation that ultrasound is the clutchest tool in all of emergency medicine. And I'm going to stand on that, Mel. Okay, but let's just take a step back. Let's break this paper down. So this scan was super easy. It is super teachable. The ultrasonographers in this paper were either an EM doc, a nurse practitioner, or a physiotherapist. They were all trained to do this scan. What they did, they took a modified 6-view approach, and they looked around the forearm. Now, based on the 6-view approach, they made a diagnosis of either no fracture, buccal fracture, or other. So I'm going to real briefly show you how they did this scan, okay? So what you're going to do, you're going to take your linear probe, you're going to scan in a long axis view, and you're going to make one big circle. Super simple. Think about it. The forearm has 2 bones. You got your radius and your ulnar, right? Each bone gets 3 views. Now, you say, all right, cool. We know how to do the scan, but what exactly am I looking for? So if you're in this paper particularly, you're looking for a buccal fracture. Cool. So it's called a buccal fracture because the outside pressure causes the bone to compress and buckle without actually snapping it. So in ultrasound, any ultrasound fans, what does bone show up as? Hyperechoic, right? Nice, bright, white line. So if you visualize it just for a second, you have a nice, bright line, then there's a dip, okay? You gotta remember the dip. Nice, bright, hyperechoic line, then a dip, okay? Now, you may see some other fracture patterns there. You may see some step-offs. In the paper, if there were some other alarming findings, they just went straight to the x-ray, right? So if you're doing the scan, you see some step-offs, something's not looking right, just order the plain films. But here's the thing, right, about ultrasound use in the emergency department. There will always be critics. There will always be skeptics. I remember the first time that I did this scan as a resident, right? I'm gonna tell you how this story went. So I worked in a pediatric emergency department. And pretty much any fracture that we had, we consulted ortho, okay? That's just the way the cookie crumbled, any fracture we had. So that same kid that I had, I go into the room, I had my linear probe, scanned in the long axis view, diagnosed me a little buccal fracture. Walked out there feeling like $1,000,000. Yeah, did that by myself, right? Diagnosed a buccal fracture. Went to the station, walking back all cocky, sent out a page to ortho bra, all right. So he calls me back. I let the phone ring a little bit just to, what up, bruh? Listen, man, I got this kid, 7 years old, lollygagging around in the backyard, man. Long story short, got a little buccal fracture. Think you can arrange for expedited follow-up? Ortho bro's like, sure, dude, totally. But hey, did this kid get transferred or something? I don't see any plain films in the chart. Plain films in the chart? How dare he? Nah, listen, man, I got it all ultrasound, okay? It was all hyperechoic. Then there was a dip. Ortho bro's like, sure, dude, but how do you know it's broken? It's a dip. Sure, dude, but how do you know it's broken? Listen, man, I got the scans here. The images are saved. It's a dip. You can pull up. Look in the chart. He had ordered the plain films. And that's the thing about ultrasound, right? It continues to grow. However, if our colleagues aren't on board, then it can be a little bit tough to kind of push some of these findings forward. But that's one of the reasons why I like this paper, because not only did we have EM there, but we had radiology and ortho as well. Here's another point. So I work in a pretty busy community shop, and y'all, I'm actually fresh off a shift where I just got crushed, destroyed, demolished, demoralized. Nah, it wasn't that bad, but it was super busy. Can you imagine overnight, solo coverage, 20 patients in a waiting room, right? Just strolling through the ED, making your rounds, and you see a kid in bed 6, 8 years old, holding his forearm. You look at him and you say, you look like you could use an ultrasound. So you go, get the ultrasound. We have a venue, so it's big. So you got to bring that thing over here. And then you say, oh, wait, I got to grab some towels. I got to make sure we clean up after ourselves. So you got the ultrasound. Say, hey, I'm Dr. Chill. We about to get the scanning. Okay, buddy? Oh, this thing is on 5%. Let me plug it up. Okay. Hey, man, can I see your bracelet? What's your MRN? Okay, boom, 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 boom. Now I got my linear probe. All right, I'm scanning in a long axis view. Meanwhile, the kid can't stay still to save his life. Nah. If I'm in a busy setting, if I'm getting crushed, this scan is probably not going to be feasible for me, right? I'm just going to order the plain films. Last point, then I'll shut up. Let's talk a little bit about its global impact, right? So in rural parts of the country, in other countries, there's not access to a robust radiography infrastructure, right? It's just hard getting imaging done. Ultrasound is becoming more and more affordable. It's relatively easy to teach, and so this can be a game changer in many of these communities, right? You can potentially spare that single mom with 3 kids having to transfer to a center 3 hours away. Meanwhile, she has to be to work in the morning. She has to arrange for somebody to watch her kids, or in Eastern Africa, where in certain parts of the country, the nearest clinic with x-ray capabilities is a day's trip away. You mean to tell me I have to send my patient on a day's journey for an x-ray when I have this butterfly right here? God, I'm gonna use this scan. So, all in all, I enjoyed this paper. I thought it had its pros and cons, but I would implore you to give the scan a try. If you're working in a pretty busy setting, this might not be the scan for you. However, if you're working in a rural setting, if you're doing some global health work, and a patient like this comes in, think about that ultrasound. Have those conversations with your colleagues, because remember, we need them on board too, and keep pushing the scanning culture forward. That's all I got.
Fantastic. So, I got one question.
Yeah.
And that is, could you teach me to do this?
Absolutely.
Because I don't know anything about ultrasound. I mean,
Absolutely.
nothing.
Absolutely. So like I said, you're going to get your linear probe that's going to give you high frequency, low amplitude. So you're going to be able to identify a lot of things there. Forearm, 6 views, right? So volar, lateral, dorsal, volar, you're done, right? Now you can put in some short axis views. You can look for secondary findings, maybe some hematomas. You can identify vascular injuries. By all means, get fancy with it. But it's super easy. There's so many resources out there that you can kind of take a look at. In this paper, they were able to give you just an overview of what they were looking for and how the fractures looked. But super easy scan. Someone can teach, anybody to do this, especially if you're in those rural areas, if you're in countries that don't have access to radiography. I say, why not scan them?
How many people here have done an ultrasound for a fractured arm? Oh, look, there's some hands up in here. Look at you, special fancy people.
Absolutely.
Thanks, Cody.
Yep.